Welcome to UMCC Medical Consultant Connectors, where your health matters to us. Brucellosis is a disease. It is caused by bacteria called Brucella. These bacteria mainly infect animals. Animals like cattle, pigs, and goats can carry Brucella. Brucellosis is a zoonotic disease. This means it can spread from animals to humans. While it's more common in developing countries, brucellosis can occur anywhere. It often affects people who work with animals or consume animal products. Brucellosis can cause a range of symptoms. It can be difficult to diagnose. Early diagnosis and treatment are crucial. They help prevent serious complications. This essay will explore the causes, symptoms, diagnosis, treatment, and prevention of brucellosis. Understanding this disease can empower individuals to protect themselves and their communities. Brucellosis spreads from animals to humans in several ways. Contact with infected animals is a primary mode of transmission. This includes direct contact with an animal's blood, fluids, or placenta during childbirth. Consuming contaminated animal products is another common way people get brucellosis. Unpasteurized milk and dairy products are particularly risky. Undercooked meat from infected animals can also harbor the bacteria. Airborne transmission is possible, though less common. Inhaling dust or particles contaminated with Brucella bacteria, especially in areas where infected animals are present, can lead to infection. It's important to note that brucellosis does not typically spread directly from person to person. Most cases involve animal-to-human transmission. Brucellosis symptoms can vary greatly. They often resemble the flu. The time between getting infected and showing symptoms can range from a few days to several months. Fever is a hallmark of brucellosis. It can be intermittent, coming and going in waves. Other common symptoms include chills, sweats, headache, and muscle and joint pain. Fatigue is another common complaint. People with brucellosis often feel very tired and weak. Loss of appetite and weight loss can also occur. In some cases, brucellosis can cause more serious complications, affecting organs like the liver, spleen, heart, or brain. Section 4. Diagnosis and detection methods. Diagnosing brucellosis can be challenging. This is because its symptoms mimic other illnesses. Doctors rely on a combination of methods to confirm a diagnosis. A thorough medical history and physical exam are essential. The doctor will ask about potential exposures to animals or unpasteurized dairy. Blood tests are crucial for detecting the presence of Brucella antibodies. Culturing the bacteria from blood, bone marrow, or other body fluids is the gold standard for diagnosis. However, this method can take several weeks to yield results. In some cases, imaging tests like X-rays or ultrasounds may be used to assess the extent of the infection. Section 5. Treatment and management of brucellosis. Treating brucellosis involves a combination of antibiotics. The type and duration of antibiotic therapy depend on the severity of the infection and the individual patient's needs. Typically, treatment involves a combination of 2 antibiotics taken for several weeks. Doxycycline and rifampin are commonly used antibiotics for brucellosis. Close monitoring is essential during treatment. Patients need to complete the full course of antibiotics, even if they start feeling better before finishing the medication. This helps prevent the infection from recurring. In some cases, surgery may be necessary to drain abscesses or address complications. Section 6. Prevention strategies. Reducing the risk. Preventing brucellosis involves a multi-pronged approach. Protecting yourself and communities requires awareness, education, and responsible practices. Avoid consuming unpasteurized dairy products. Pasteurization effectively kills Brucella bacteria. Ensure meat is cooked thoroughly to eliminate the risk of infection from contaminated meat. People working with animals should take precautions. This includes wearing protective clothing, like gloves and masks. Vaccination of animals is crucial for controlling brucellosis in animal populations. Good hygiene practices, such as frequent hand washing, are essential for everyone, especially after handling animals or animal products. UMCC, your ultimate medical consultant connectors.